Fuck Cholesteatoma.
Yep, that pretty much sums it up. Welcome back, everyone. Today's episode's going to be a little bit different. Instead of talking about something, pre-planned and then sharing this week's struggle and strive with you guys, today's going to be a little different in that we're going to just talk about, or I'm just going to talk about a recent struggle and strive, but in reverse order. Why reverse order? Well, honestly, if I did the strive second or kept the best for last, so to speak, then I might forget to come back to it because the struggle is pretty significant for us. But I do want to cover a strive because although we all have struggles, we need to make sure we celebrate our successes too. So with that, today's strive is that we're all here. We made it to a second show, or I made it to a second show, and hopefully you're here too. It may not seem like much, but with all that life throws at me, and I assume you guys too, the fact that I'm here again and in front of the camera again, and you're here with me is awesome, and I really appreciate it. Now the struggle. So our oldest daughter has had recurring cholesteatoma, which I'll explain what that is in a second, and it's. I mean, she's got other stuff going on and other diagnoses too, but this one in particular has been almost a lifelong struggle, and it's destroyed her hearing. She wears hearing aids, and it's just been a rough road. So what is cholesteatoma? Well, it's the official definition, I guess, is it's a sac of dead skin cells that form up a pocket in your middle ear. And it grows and slowly gets larger and larger so that eventually it fills your middle ear and what's called the mastoid bone, which is kind of like these. You can think of it as a sponge, but it's bone, so it's got little tiny air pockets in it. Anyways, it grows into there as well. And if left untreated, if if you're lucky, you'll have an unpleasant smelling discharge or pus that would come out of your ear. But in most cases, it results in loss of hearing. It can result in nerve damage, so that you can lose sensation or maybe even muscle control of, say, whatever, if it's your left ear or right ear, depending on where the cholesteatoma is. It could look like you've had a stroke, essentially, because you can't control those muscles. And it's just nasty. The way I tend to describe it is that it's, these are my words, right? Is that it's basically kind of like a tumor that's made up of skin cells instead of cancer cells. And the only treatment for cholesteatoma is surgery. And similar to a tumor or cancer, if there's even just one cell of cholesteatoma left behind, it can come back again. So anyways, our oldest daughter has had this since, I don't remember how old she was when she was first diagnosed. It was young enough that back then it was easy to get her to go to the surgery because she was little and didn't know any better. It's like, oh, I get to go somewhere with Dad. So I mean, she had to have been, God, I'm gonna guess like 4 years old or somewhere in that ballpark. And anyway, she's had. I'll have to go back and look, but I think she's had probably 9, maybe 10 surgeries now. And each surgery is preceded by an MRI, and she has to get an IV because they put contrast in. They do an MRI with and without contrast of her brain or her head. And at this point, I've seen so many MRIs that I feel like I can read an MRI and based on the images know the result. ahead of time, so that going to see the ENT or the surgeon to talk about the scan results is really just a formality for us at this point, unfortunately. Um, so the surgery itself, and I'll see if I can find some images to overlay here to give you an idea. But the surgery itself basically entails them, in our cases at least, an incision behind her ear from basically the top to the bottom, but behind her ear, kind of just in front of that crease in your ear, behind your ear there. Some cases they do it in the front, but hers has always been in the back to kind of hide the scar. Um, so they do a long incision there, and they basically rip your ear forward, for lack of a better term. And then, depending on where the cholesteatoma is and how big it is, um, they'll they'll just start scooping out, or in a lot of cases, or in her case at least, they grind through um, the mastoid bone, or her skull, basically, um, to to clear it out of those kind of spongy bone pockets I was talking about earlier. And the first time they discovered she had cholesteatoma, it was a CT scan for something totally unrelated. Um, Luckily, they found it though. But by the time it was discovered, and we got in for surgery and everything like that, and again, she was probably like 4 years old or something in that ballpark. Um, it had already eaten through part of her skull, um, and was basically sitting on top of the carotid artery in her head or in her brain. Um, and they had said if it had gone much longer, it would have actually compromised that artery, and she would have basically had been hemorrhaging blood in her head. Um, in a Unfortunately, it came back, um, and in a subsequent surgery to remove it, they also, in an attempt to restore some of her hearing, replaced one of the small hearing bones, the malleus, the incus, and the stapes, the things you'll learn about in like elementary or junior high, I don't remember which, but they replaced one of those that had been damaged by the cholesteatoma earlier in life, with kind of a small prosthetic, which I didn't even know they made prosthetics that small, because I mean these things are like really tiny, right? Um, so, anyways, they replaced that to try and restore some of her ability to hear. Um, it sort of worked, and not really though, but ultimately didn't matter, because unfortunately it came back again. Cholesteatoma came back again, and this time it kind of wrapped itself around um, that prosthetic. So not only did the cholesteatoma itself have to be removed, of course, but um, the prosthetic had to be removed. And that was probably, I don't know, I'm going to say probably about 5 or 6 years ago at this point. And we haven't pursued, a new prosthetic or any other attempts to restore um, her hearing in that ear, left ear, um, since, um, just because the situation going on inside there has been so unstable, pretty much since she was a small child. That just hasn't been worth it, really. Um, Maybe down the road, we'll look at some sort of reconstructive, hearing restoration surgery, um, or maybe not. I'll get to the why, maybe not, in a bit, but um, yeah, I mean, she's been through a lot. And these surgeries, these 9 or 10 or whatever the number is, I'll look up. But this is every year. She's basically had to go in for periodic MRIs, with an IV, and this surgery where they basically cut her ear off and stitch it back on, um, every year since she was about 4 years old, and she's 15 now. But man, she's tough. Um, I I I can't. I don't think I could do what she's. I couldn't go through what she's gone through. She's a warrior. Um, I mean, she like I said, she does the IV for the MRI and doesn't complain about it. Um, Despite this incision on the behind her ear and like the grinding through the skull bone and all the stuff that they do in there, I, I can't believe it, but she doesn't take pain meds after the surgery either. Not at all. Not even like Tylenol. Um, her biggest concern or issue with the surgery is, it's kind of funny, is after the surgery, because you've had this, you have this incision and stitches behind your ear. They send you home with this kind of plastic cup. They velcro around your head, to protect your ear especially while you sleep, right? Her biggest concern about these surgeries is how long she's gonna have to wear the damn cup on her head. Because she hates the cup. Um, so I mean, we've done these surgeries, like I've said, for so long. There's another type of kind of more invasive version, drastic version of the surgery called a canal wall down that we have not done, um, yet, because um, it entails basically removing the lining of your ear canal going into your inner ear, um, and then they enlarge the ear canal, so from the outside you can actually see a larger ear hole, opening, whatever it's called. Um, and then there's this they scrape away enough of the bone so that inside your head or inside your inner ear there's a bigger opening or cavity space, right? And the idea is that with the wider ear canal and the opening inside, it gives the cholesteatoma a place to grow into, because like many things, like water freezing, it'll the cholesteatoma will take the path of least resistance. So if there's a clear opening in front of it and your brain and other important things behind it, it'll tend to grow forward into the opening. And with the larger ear canal, the idea, our hope, there's no guarantee, but the hope is that they can go in through the ear canal, um, and either I don't know, pick or scrape or suction cholesteatoma out periodically, um, instead of having to do general anesthesia and go into surgery where they do incisions and all sorts of all that nasty stuff. We have not done that yet because, like many kids, she loves to swim, and um, with the canal wall down, you have to be extra careful about getting water in there, because you don't have an eardrum anymore. So the concern about getting water or moisture in there is that it'll lead to chronic ear infections. So things like swimming and bathing, become more difficult. And because you have this large opening and for cholesteatoma to go into, and hopefully for them to be able to remove inside of a doctor's office instead of an operating room, other things can get in there, you know, dust, debris, whatever. So um, by doing a canal wall down, you're also, in addition to the lifetime routine for any time you want to go swimming or take a bath or shower or anything like that, you're also signing yourself up for a lifetime of once or twice a year cleanings where you go into a doctor's office and lay on the exam table. I'll see if I can show a picture of the recent cleaning she did when we went in there to talk about the MRI results. But you're basically signing up to do that once or twice a year for the rest of your life. Um, and for that reason, and we didn't want to take away, swimming from her. Um, I mean, we didn't. Hindsight's 2020. If we knew there were going to be this many surgeries ahead on this road, we might have made different choices. But in the earlier years, we opted to not do the canal down because of those lifelong things we'd be committing her to, and we wanted her to be old enough, um, maybe not necessarily old enough to make the decision herself on her own, but at least old enough to kind of understand the consequences of that decision and what she was, going to be signing up for, basically. Um, so, like I said, she's 15 years old now, not quite an adult by in legal terms, but um, I think we're there now. We've reached the point where she's been through enough times. She knows what the surgery is like and the recovery is like. Um, she knows what the cleanings are like because even though she hasn't had a canal all down, her doctors, she's seen, I think, 4 different ENT doctors or surgeons over her lifetime for this. Um, so she's familiar with what these cleanings are mostly like because, like I said, she's had them done every time we've gone in after an MRI. Just because they have to remove all the junk so they can see inside also. Um, so we haven't talked to her yet about the upcoming surgery, which we don't know when the surgery will be. We just know we got we did the MRI a couple weeks ago, just before Thanksgiving, and then just after Thanksgiving, we saw I saw the results and or the scan and said, okay, yep, it's back. And then our appointment with the doctor was, I think, the week after that, where he pretty much confirmed it. So um, she will have another surgery in her future. It's just a matter of how far out. Um, at this point, I've already scheduled her an MRI and another MRI in 3 months from now. Um, because what we talked about at her last appointment was we'll since she's had so many surgeries, we don't want to just necessarily keep doing the same thing over and over again anymore. Um, so we'll do this MRI in 3 months, see how the cholesteatoma has changed, if it's grown, which it will, how much it's grown, and that'll kind of dictate if we need to do something in terms of surgery right away, or if we can wait 3 more months, 6 months, whatever. Um, like I said, she's gone through this surgery every year, so her cholesteatoma seems to be particularly aggressive. So I don't, and it's been a year, basically pretty much a year since her last surgery. So um, we'll do the scan in 3 months and assess, but I'm not expecting we'll be able to wait much longer, if at all, after that. And that'll be the point where um, we sit down with her and talk about the options and see what she wants to do going forward. If we keep doing the same type of surgery she's been doing pretty much all her life, or if we pursue this canal wall down procedure or surgery instead, and and then she basically knows that that's what she'll be doing for the rest of her life. So yeah, that's our struggle for this week. Um, I plan on circling back and updating you in about 3 months after the scan and see where we've landed. Well, until next time, take care, everybody.